Well, it is a time for our Midday Health Minute sponsored by St. Mary's, and we are so excited to be joined by Dr. Curry-Winchell, BCW.
Yes.
Dr. BCW is how you like to be known. But to talk to us a little bit about the urgent cares around St. Mary's, what they're used for. But first of all, we do got to give you guys a little shout out because your cardiovascular unit was just recently ranked pretty high.
Yes, it was. It really speaks to just the quality, high quality of care that St. Mary's has always been able to do and continues to do. So we are honored to receive such a wonderful recognition.
Yeah, it's number 3 in the nation, according to Fortune. This is a recent ranking that just came out, so that's very exciting. Now, let's get to those urgent cares, because I think a lot of people maybe don't necessarily know when is the appropriate time to go to an urgent care. Maybe they are going because they're using it almost like their doctor. So I wanted to just talk to you a little bit about that. You have 4 of them across the area.
Yes, we do. And you know, when it comes to an urgent care, it can be difficult to know when should you go in. So I always like to share with patients that whenever you're experiencing something that is like immediate and it's for an injury or an illness, but it's not life-threatening, that's the time to go in and find an urgent care, because that's what they're there for, to really help you with an immediate need as long as it's not life-threatening.
And is that something, if I can't get into my doctor as well, should I call my doctor first or should I go to an urgent care?
So you can do both. It all depends upon, you know, the nature of the injury or illness. And, you know, if your doctor is not available, just come into the urgent care. And even if they are, some patients sometimes call on their way. And so the one part that I love about our urgent cares, we are all about continuity, meaning we will let your physician know that you came into the urgent care. So, you know, even if you didn't get a chance to call them, we'll make sure to kind of share the information of what happened in the urgent care. So it's all about that continuity.
Are you finding people are going to urgent cares when they should be going to emergency rooms, or vice versa?
So it's a blend of both. And, you know, I always tell patients it's okay. At least you sought out care. And so never feel bad about being at the wrong place. But I love being here because I can share how urgent care is there for those, you know, acute injuries or sprains or, you know, possible bladder infection. All of those things were there for you. You know, for the emergency room, if you're having difficulty breathing, chest pain, that is really the best place for you to go. Either way, we'll take care of you with whatever place you end up. And so I think that is vital to know.
Yeah, especially you want to be in that hospital if you're feeling those chest pains. I mean, that could be a sign of something very significant. So you want to be in a place where that has the best care available for you. I always joke with the urgent care. So my husband almost, he was being a husband and, you know, playing around with tools.
Yes.
And he stabbed himself a little bit with a tool. I was like, gotta go get that tetanus shot, honey.
Yes.
You have to, you gotta go. And thankfully we went to the urgent care and they were able to, you know, check it out. It wasn't as bad as it looked, so everything. And those are kind of those scenarios where urgent care is good.
Absolutely. You know, when an accident happens and you never know when it's going to happen. And so really utilizing the urgent cares for shots, for, you know, being able to repair an injury that may have happened. Any of those factors, that's what we're there for.
Now, what if someone says, you know, my insurance isn't great, I'm not sure if it's going to cover an urgent care, what would you say to that?
So, you know, there's no harm in calling in advance, or we can call for you when you come into the urgent care. But the biggest thing I always like to highlight is don't wait, because, you know, getting care as soon as possible is the #1 thing to do. And so at St. Mary's, and this is why I love being there, we are there for you when you need us. And so we can always help, you know, call afterwards. But when something happens and you need immediate care, go in and seek it, because I always say your health is your most prized possession. So that should be at the forefront.
All right, very wonderful. A lot of great information. Doctor, thank you so much for being here.
Thank you for having me.
We'll be right back.